Welcome to Bite-Sized Learning, where we break down complicated topics and make them easy to understand and remember. Today, we're diving into a topic that affects many of us: anxiety. Anxiety is a natural human response to stress, but it can become a debilitating condition if it's not managed properly. In this video, we'll be taking a comprehensive look at everything you need to know about anxiety. Before we begin, please like, share and subscribe for more bite-sized learning videos. What is anxiety? Having anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's about to happen. For instance, some people may feel anxious and nervous about job interviews or speeches on the first day of school. If your anxiety symptoms persist for at least 6 months and interfere with your life, you may be suffering from anxiety disorder. What are anxiety disorders? Anxiety about moving to a new city, starting a new job, or taking a test is not unusual. The feeling of ordinary anxiety is unpleasant, but it does not interfere with your everyday life. It motivates you to work harder and do a better job. In the case of an anxiety disorder, the feeling of fear may be with you all the time. It's intense and sometimes debilitating. If left untreated, this type of anxiety can prevent you from doing things you enjoy. For example, it may stop you from entering an elevator, crossing the street, or even leaving your home. Anxiety disorders are the most common form of emotional disorder and can affect anyone. But, according to the American Psychiatric Association, women are more likely than men to receive a diagnosis of an anxiety disorder. What are the types of anxiety disorders? A variety of disorders are impacted by anxiety, including panic disorder. This means you experience recurring panic attacks at unexpected times. Phobia. This is an excessive fear of a specific object, situation, or activity. Social anxiety disorder. This is an extreme fear of being judged by others in social situations. Obsessive-compulsive disorder. This means you have recurring irrational thoughts that lead you to perform specific, repeated behaviors. Separation anxiety disorder. This means you have a fear of being away from home or your loved ones. Illness anxiety disorder. This is anxiety about your health, formerly called hypochondria. Additionally, anxiety is a symptom of a number of other mental health and medical conditions, such as post-traumatic stress disorder, PTSD. This is anxiety following a traumatic event. Major depressive disorders. A strong relationship exists between depression and anxiety. Chronic disease. Managing conditions such as chronic obstructive pulmonary disease, COPD, and diabetes may result in anxiety symptoms. Inflammatory conditions. Anxiety can lead to chronic inflammation and diseases such as arthritis, substance use disorders. Many people with anxiety may try to self-medicate to help manage their symptoms. Chronic pain. Anxiety is often found in those with chronic pain disorders. What are the symptoms of anxiety? People experience anxiety differently, feeling butterflies in their stomachs or racing hearts. You may feel out of control, like your mind and body are disconnected. There may be a general feeling of fear and worry, or you may fear a specific place or event. Panic attacks may also occur. Symptoms of anxiety include having trouble controlling anxious thoughts or beliefs, restlessness, concentration difficulties, sleeping difficulties, feeling fatigued, feeling irritable, unexplained aches and pains. Symptoms of anxiety might vary from person to person, which is why knowing the types of anxiety symptoms can be helpful. What is a panic attack? In a panic attack, intense fear comes on suddenly and peaks within 10 to 20 minutes. The initial trigger may or may not be known. Panic attacks have physical symptoms that can mimic heart attacks. If you believe you are having a heart attack or mentally ill, the symptoms may worsen. You may also be afraid of being judged negatively if you are having an attack in public, which may exacerbate a panic attack. The symptoms of panic attacks vary greatly from one person to another, and they may change over time. There are a number of symptoms that are commonly associated with a panic attack, including chest pain. It feels like you're choking, fear of losing control, feeling of impending doom, hot flashes, sweating, and chills, shaking, feeling of numbness or tingling in your hands, feet, or face, an upset stomach or nausea, shortness of breath, fear of dying. You may have a panic disorder if you have repeated panic attacks or anxiety attacks. What causes anxiety? Experts aren't sure of the exact cause of anxiety. However, several factors may contribute, including stress, the presence of other medical conditions, such as depression or diabetes, anxiety disorders in first-degree relatives, environmental concerns, such as child abuse, addiction to substances, situations such as surgery or occupational hazard. Researchers also believe that it is a result of the brain areas related to fear and memory storage and retrieval. Who is at risk of anxiety disorders? Each type of anxiety is associated with different risk factors. But there are some general factors to consider, including personality traits. This includes shyness and nervousness in childhood. Life history. This includes being exposed to negative or stressful life events. Genetics. 25% of those diagnosed with anxiety have a first-degree relative who is also diagnosed. Other health conditions. Anxiety can be caused by thyroid problems and other health conditions. Stimulants. Your symptoms can be worsened by caffeine, specific substances, and medications. Are there tests that diagnose anxiety? There is no single test for diagnosing anxiety. Instead, mental health tests, physical examinations, and psychological questionnaires are all necessary. A medical professional may perform a physical exam, as well as blood or urine tests to rule out underlying medical conditions that might be causing your symptoms. Several anxiety tests and scales are also used to help a doctor assess the level of anxiety you're experiencing. What are treatments for anxiety? A doctor can discuss treatment options with you once you've been diagnosed with anxiety. Treatment can help you overcome the symptoms and lead a more manageable life. Treatment for anxiety falls into 3 categories. Psychotherapy. Therapy can include cognitive behavioral therapy and exposure response prevention. Complemental health techniques. Mindfulness, yoga, and self-management strategies such as stress management are ways to treat your anxiety using alternative methods. Medication. Doctors prescribe anti-anxiety and antidepressant drugs. By meeting with a therapist or psychologist, you can learn tools and strategies to cope with stress. As a result of their high dependence risk, benzodiazepines are commonly used to treat anxiety, but are usually avoided if possible. Your mood and stress are improved by taking anti-anxiety or antidepressant medications such as escitalopram, which alters your brain chemistry. Some other commonly used medications include selective serotonin uptake inhibitors, SSRIs. Escitalopram, fluoxetine, and paroxetine are common SSRIs. Selective norepinephrine reuptake inhibitors, SNRIs. Duloxetine and venlafaxine are common SNRIs. Antipsychotics. Quetiapine and aripiprazole are common antipsychotics. Benzodiazepines. Diazepam and clonazepam are common benzodiazepines. Anxiolytics. Buspirone is a common anxiolytic. What natural remedies are used for anxiety? It is possible to reduce some of the stress and anxiety you feel every day by making some lifestyle changes. Most natural remedies involve taking good care of your body and engaging in healthy activities, whereas avoiding unhealthy ones. A few of these are getting enough sleep, meditation, exercise and staying active, maintaining a healthy diet, abstaining from alcohol, limiting caffeine intake, quitting smoking cigarettes if you smoke. Anxiety and depression. In addition to anxiety disorders, depression is often associated with anxiety disorders. Though depression and anxiety disorders can occur independently, it is not unusual for these disorders to occur together. Similarly, anxiety disorders can trigger worsening symptoms of depression. Many of the same treatments work for both conditions: psychotherapy, counseling, medications, and lifestyle changes. How to help children with anxiety? According to the Centers for Disease Control and Prevention, CDC, 9.4% of children and adolescents aged 3 to 17 are diagnosed with anxiety. A child who exhibits extreme fear, is afraid to be away from their parents, or exhibits other anxiety symptoms that affect their daily lives may be considered to have an anxiety disorder. It is also possible for children to develop chronic and persistent anxiety, leading them to avoid interacting with their peers and family members. Anxiety disorders in children can cause the following symptoms: anger, irritability, sleeping problems, feelings of fear, feeling fatigued, headaches, stomach aches. Children with anxiety can benefit from cognitive behavioral therapy, talk therapy, and medication treatment. How to help teens with anxiety? It is common for teenagers to feel anxious during these precious years. Tests, college visits, and first dates all come up during these years. Teenagers who experience anxiety symptoms regularly may suffer from an anxiety disorder. Nervousness, shyness, isolationist actions, and avoidance are some of the symptoms of anxiety in teens. As an example, they might act out, perform poorly in school, skip social events, or use drugs or alcohol. Teenagers may also suffer from anxiety and depression at the same time. It is crucial to diagnose both conditions so that symptoms can be addressed and treatment can be effective. Anxiety in teenagers is commonly treated with talk therapy and medication. These treatments also alleviate depression symptoms. Anxiety and stress. It is important to understand that stress and anxiety are related, but they are two totally different things. Stress is a normal and healthy reaction to a specific event that makes you nervous, such as an upcoming test, presentation, or wedding. Stress will go away once the trigger is removed, but anxiety persists beyond the trigger and may exist without a known trigger. Treatment may be required for anxiety. The symptoms of anxiety and stress can generally be managed with physical activity, a well-balanced diet, and good sleep hygiene. However, if you are experiencing symptoms of anxiety and stress that don't respond well to these measures, you might consider consulting a mental health professional for help. Physical symptoms of anxiety. Physical symptoms of anxiety can include dizziness, tiredness, heart palpitations, tensions and aches in the muscles, shaking, dry mouth, sweating excessively, stomachache, headache, insomnia. The feelings of stress and anxiety are not always bad. Both can give you the motivation and boost you need to accomplish your tasks and challenges. But if these feelings persist, it is important to seek treatment. Untreated depression and anxiety can lead to chronic health problems, such as heart disease. Anxiety and alcohol. When you feel anxious often, you may decide to have a drink to calm your nerves. After all, alcohol is a sedative, and it can also depress the activity of your central nervous system. People with anxiety disorders often abuse alcohol and drugs to feel better, resulting in dependency and addiction. Before treating anxiety, doctors may need to treat alcohol or drug problems. But chronic or long-term use can exacerbate the condition. Can foods treat anxiety? Medications and talk therapy are common treatments for anxiety, but lifestyle changes, such as getting enough sleep and exercising regularly, can also help. The foods you eat may also have a positive impact on your brain if you often experience anxiety. These foods include chia and flax seeds, fatty fish such as mackerel and salmon, turmeric, vitamin D, magnesium, tryptophan. Anxiety prevention. Children and teens. The cause of anxiety in children and teenagers is unknown. However, there are excellent public health approaches that can help prevent it, including suicide prevention, bullying prevention, youth violence prevention, child maltreatment prevention, mental health programs. Parents can ensure their children make healthy decisions by communicating openly and honestly with them. Getting family therapy is also a good idea if children or teens experience anxiety as a result of something in their family or at home. In particular, children and teens may not find it easy to acknowledge their anxiety or speak about their feelings, so this is important. Adults. You can prevent anxiety by following these tips. Avoidance. You can reduce stress and anxiety by avoiding people, places, and situations. However, this is only a short-term solution. In the long run, it's better to get treatment so you don't need to avoid triggering factors. Stress management and mindfulness. Practicing stress management and mindfulness prevents strain. Restrict caffeine. Caffeine can worsen anxiety symptoms. Support groups. Speaking with others is an opportunity to share coping strategies and experiences. Therapy. Speaking with a therapist can help you develop more effective ways to cope with fears and stress that lead to anxiety. Speak with a doctor about your medications. By regularly discussing medications' dosing, effectiveness, and side effects with your doctor, you can ensure your health condition is treated adequately and anxiety-related side effects are monitored. Takeaways. A combination of medication and psychotherapy can be used to treat anxiety. However, some people who have mild anxiety disorders decide to live with it and don't seek treatment for it. Anxiety can, however, be made worse by avoiding triggers in the long run. Treatment can help you overcome the urge to avoid triggers. The good news is that anxiety disorders can be treated, even in severe cases. Despite the fact that anxiety usually doesn't go away, you can still live a happy, healthy life when you learn how to deal with it. And that's a wrap. We hope you found this video informative and helpful. Remember, anxiety is a treatable condition, and with the right support, you can manage it and lead a happy and fulfilling life. Don't forget to like, share, and subscribe for more bite-sized learning videos. Until next time.